Ginger is a powerhouse of nutrients and has been a natural remedy for various health conditions for centuries. Its active components, gingerol and shogale, offer numerous health benefits thanks to their antioxidant and anti-inflammatory properties. However, there are 4 groups of people who should avoid ginger due to specific medical reasons. Keep watching to find out if you're among them and learn how to incorporate healthier habits into your life. Number 4. Blood disorders. People with blood disorders, such as hemophilia, should avoid ginger. While ginger can enhance blood circulation, beneficial for conditions like obesity and peripheral artery disease, it can be detrimental for those whose blood doesn't clot normally. Ginger can interfere with medications used for these conditions and increase the risk of bleeding. Number 3. Certain medications. If you take medication for diabetes, hypertension, or other conditions, consult your doctor before adding ginger to your diet. Ginger can interact negatively with drugs like insulin, anticoagulants, beta blockers, antacids, heart medications, and antihistamines, potentially reducing their effectiveness. Number 2. Underweight individuals. If you are underweight or struggling with anorexia, ginger might not be suitable for you. Ginger aids in weight loss by boosting digestion and suppressing appetite. For those already underweight, it can lead to further weight loss and muscle mass reduction. Number 1. Pregnancy. Pregnant women should avoid ginger, especially in large amounts. While it helps with digestion, it can stimulate premature contractions and interfere with the absorption of dietary iron and fat-soluble vitamins. Excessive ginger intake during pregnancy can increase the risk of miscarriage or bleeding. Now that you know who should avoid ginger, let's share a beneficial ginger recipe for those who can safely consume it. This recipe helps remove mucus from your lungs and cure a bad cough. You'll need 1 tablespoon of organic honey, ginger powder or grated ginger, olive oil, flour, gauze, a napkin, and adhesive tape. Mix flour and honey in a bowl, then add olive oil and ginger. Spread this paste on a napkin, wrap it in gauze, and apply it to your chest, securing it with adhesive tape. Leave it on for 3 hours before bed to let the mixture work effectively. While it can cause skin irritation, adding more honey can minimize this. Beyond treating coughs and mucus, ginger offers several other health benefits. It fights fungal infections, eases menstrual pain, and lowers cholesterol levels. For instance, a study found ginger to be effective against yeast infections and as effective as ibuprofen in relieving menstrual pain. Additionally, it can reduce bad LDL cholesterol and increase beneficial HDL cholesterol, promoting heart health. Incorporating nutritious foods like ginger into your diet can improve overall health and contribute to a healthier lifestyle. However, always consult your doctor before making any significant dietary changes, especially if you have existing health conditions. Your health journey begins with informed choices. If you enjoyed this video, please like, share, and subscribe to our channel for more health tips. Thanks for watching.